This is Bridges, and welcome. Clinical governance infrastructure is essential to an effective and functional health ecosystem. Without it, the health space, irrespective of its interventions and efforts, can be regarded as comatose or very ill. What does an effective leadership and clinical governance mean to our nation's individual and herd health? Modern medicine is tending towards precision and multidisciplinary collaboration for effective service delivery. Can we get there? Are we groomed? Are we trained to be able to be on this global health ecosystem? Now, how do we do that? Collaboration, they say, for effective service delivery is needed, especially without a well-defined clinical governance leadership infrastructure. This cannot work, and we want to make it work. We want the health sector to work so that the healthy herd of Nigerians are alive to accelerate better Nigeria. So that's today's outlook on Bridges. Welcome, I'm Muji Makochola, and we're still working for a sustainable society. With us today, I have with me a former head of neurosurgery at the National Hospital here in Abuja. We can call him Chief Consultant Neurosurgeon. Now, while we're starting with while we're starting with the brain, it's important. If the brain is not functional, then the experts say we can't do the things that we do like every day. This gentleman that we caught in the course of seeking treatment and making it say to us that even the specialization available in Nigeria is first trained at the University of Nigeria in Nsukka, postgraduate training at the National Postgraduate Medical College. He has a post-fellowship training at the University College Hospital in London and even worked there. He has other trainings at also University of Switzerland, and I can go on and on and on about who this formidable Nigerian is, who left supposedly the green pastures to come back home and serve his people. Please welcome with me Dr. Ugochukwu Ugowany. I hope I called that right. Charles, Chief Consultant Neurosurgeon. You're welcome.
Thank you, Muji. And good morning, Happy New Year, Nigerians. I am happy to be here indeed.
Oh, yes. Thank you so much. So we're going to be speaking to leadership and clinical governance infrastructure. Leadership and then clinical governance infrastructure. People always say, well, just give them a hospital. That's what they need for doctors to work. But I think it's beyond that. What's your take when we put these two together and as we try to build a solid bridge of, a sustainable bridge of leadership and governance within the health ecosystem?
Yes, thank you very much. There's a popular saying that a hood does not make a monk. And what that simply means to me is that hospital is not just the structure, it's not just the building. There has to be proper leadership and clinical governance for safe delivery of healthcare delivery in line with acceptable international standards. It is no longer acceptable for us to say that because we're Nigerian, then we are going to accept any sort of treatment because we're in Nigeria. The treatment that you get in Nigeria should be the treatment that you get, should be equivalent to the treatment you get anywhere in the whole world. Now, let me take you back to some of the reasons why Nigerians seek medical treatment abroad. There are something we'll call the 6 pillars of any effective healthcare delivery system. Top on that list is leadership, clinical governance, and then followed quickly by healthcare financing, infrastructure development, and equipment, biomedical engineering. So for us to have an effective healthcare delivery system in Nigeria, we need to go back to those reasons why Nigerians seek medical treatment abroad. It is because those 6 pillars of an effective healthcare delivery system, they're simply working over there. Therefore, if we provide and strengthen those pillars, it means that any Nigerian who seeks to embark on medical treatment abroad, it's not that there are no better options locally. It's simply because he has a choice to do that. And it is doable. Now let's look at leadership in a bit more details. Let's dilate it a little bit more. To provide leadership in our healthcare system requires a careful selection process to put a round
Peg.
peg in a round hole. And to put a square peg in a square hole. It should be devoid of our traditional politics. We must go for the best, and the best is out there. The process of selection must be seen to have adhered with acceptable standards. If possible, engage consultants who are specially versed in selecting people who head these our institutions of Apex healthcare delivery. When that happens, there will be effective leadership, clinical administration, clinical governance. And what do we expect in a hospital that works? What we expect in a hospital that works is that every department that is relevant to the delivery of sound
and
healthcare system, yes, must work. You must cascade into selection of leadership different departments, ranging from pediatrics to geriatrics and all the subspecialties. I think today we are focusing on non-communicable diseases. Of course, there are also other diseases, but we'll focus on that. For our healthcare system to deliver those kind of services that will match whatever we get out there in terms of providing care for non-communicable diseases, we should have these different departments that work optimally. Now, Nigeria has unlimited potential to develop human capital as far as different medical and surgical specialties are concerned. We have so many top-class teaching hospitals, specialist hospitals, where specialist training is happening every day. So we produce top-class specialists. I'm a product of specialist training in Nigeria. All I simply did was to go out there and acquire more skills, exposure, competence, confidence to come here and serve. However, the problem that we have is that there is human capital flight. We develop so many specialists, but we don't have the capacity to keep them. So the leaderships in our teaching hospitals and specialist hospitals, they've done so well in human capital development to populate these specialties. And when I say specialty, high-end specialties, cardiac surgeries, orthopedic surgeries, spine surgeries, neurosurgery, we produce them. But the point is, do they stay? No, they don't. And that puts a lot of stress on the system. We produce so much and we retain very little. So it is important for us to look at those factors. Why we produce so much at huge expenses to the socio-economic health of this country, and we are unable to keep them. We need to examine those factors in greater details so that we'll know at what point to intervene to reduce them and keep them here. Consequently, those departments are not very well populated, and that cascades into defective services that are being rendered in those departments.
I just want to quickly bring, since we're looking at non-communicable diseases and double tragedy for Nigeria, we still have the communicable diseases to deal with. Let's look at, are we as a country, even with the present administration that is doing so much in terms of bringing in new things that can help to keep human resources, at least to reduce capital flight, so to speak, infrastructure becomes an imperative. What has happened Because over the years, at some point, we have government bringing so much money to revamp, to redecorate, to bring in machines. And these are the machines you see anyway when you go outside this country. Why have we not been able to maintain what we have? Take, for example, cancer. Sometimes you find out that, the times would change according to what we have now with the new administration, but that we still lack infrastructure in terms of it can never be enough, but such that people don't have to die waiting for treatment. What's your take on this?
Thank you very much. Closely tied to human capital development is infrastructure and necessary biomedical engineering. Sending a doctor to go and work without necessary equipment is like asking him to go to the middle of the jungle to catch a lion with bare hands. It doesn't work. It won't work that way. So what has happened is that in the past, government has invested so much to develop infrastructure. Government has put in so much funds to equip these hospitals with state-of-the-art equipment. Mm-hmm. But it is man that will man those machines. People who have been trained to operate those equipment, they don't stay. So it still goes back to
same vicious circle.
Human capital development and strategies to sustain, to keep them. We need to examine that. What is the reason why they are not staying? Now, when such highly sensitive equipment are handled by very less qualified, less trained people, they are bound to be mismanaged. Then, when they get mismanaged, they malfunction, and that brings me to the next. The next is biomedical engineering. If you develop biomedical engineering, you must have biomedical engineers who are trained in relevant specialties. For instance, a biomedical engineer trained to maintain Philips MRI may not have the necessary knowledge to maintain and service Siemens MRI machine, may not have the necessary knowledge to maintain and service Toshiba MRI. The same thing goes to Philips, to CT scan. Mm-hmm. You have GE, you have Philips, you have Siemens, you have all sorts of equipment. So this biomedical engineering is defective as far as we are concerned in this country, and that is why these equipment are grounded for very simple reasons, because there is no proactive maintenance, and then we lose them.
So there must be a uniformity. Is that what you're conversing?
Yes.
In terms of getting this high-end medical equipment that are necessary for us to, because with every humility, I've visited a lot of hospitals outside Nigeria, and I see some of these equipment that we have, and one is beginning to wonder. And you ask them, they say, oh, this one has been on for 15 years use, 20 years use, but we don't even get that lifespan for some of our equipment. So you are now conversing that, are you conversing now that there should be some measure of uniformity in the kind of equipment that we get, because we don't manufacture them here now?
Well, perhaps that could help. But what will help more is that whatever equipment we are planning, in the planning phase of procuring an equipment, there has to be incorporated into that plan the long-term maintenance culture. It doesn't matter which type of equipment. It depends on which one that the government has seen, feel comfortable dealing with at any point in time. But there has to be an incorporation into that plan, long-term maintenance and development of local biomedical engineering. That, it gets to a point where to maintain service and equipment, you're going to fly in engineers from the US, and that is a lot of money. And the structure of hospitals now, there is no really budget for that. I'll give you an instance. If you look at cancer treatment in Nigeria today, it is more or less being driven by the private sector. Most cancer treatment centers that are in public hospitals are grounded, and it's all because of maintenance culture. But luckily, private investors are diving into the area now, and that applies to all the high-end biomedical equipment, CT scan, MRI. If you look at the healthcare delivery space, even in Abuja and beyond, you find out that the centers where these services are sustained on 24/7 basis are mostly in the hands of private investors.
And at a very high cost.
Yes.
When you think about the imperatives, what is needed
Yes,
to make them run.
Yes, because this government subsidy is not there. Government isn't supporting them. First, to import these equipment are very expensive, and secondly, to service them much more expensive. Three, even the operational costs, the cost of energy, the cost of diesel to run this machine. For instance, MRI, once it is powered, any 1 minute of power outage is not acceptable because the collateral damage will be so much. And these are some of the problems that we see in those high-end equipment in public hospitals, because there are no immediate measures to stop these things from happening. We see some teaching hospitals going cap in hand to the ministry, begging for money in order to offset accumulated NEPA bills, energy bills. You go to some teaching hospitals, you find out that they are running their operating suites with little generators because there hasn't been power. The wards are not powered. So how can we run a system like that? What sort of equipment? The hospitals that we go to abroad, energy isn't a problem. It can't be a problem because these equipments are designed, the power ICs in those equipments are designed not to suffer any even current fluctuation, not to talk of power outage. And when such happens in Nigeria, it doesn't happen once. Machine can tolerate it once. It doesn't happen twice. When it becomes habitual, that machine is headed for prolonged dysfunction.
So we're talking now, let's go straight to what you do, neurosurgeon.
Yes.
And in recent times, we don't have the statistics here, but more and more people are needing this precision treatment and this intervention. Now, what would you say to our viewers here? What are the components of things that aggravate what you see now? You see stroke, cardiac arrest, and the next thing you hear, died suddenly. And because of our limited health knowledge, people still attribute a lot of this to somebody in my village is after me. So as a neurosurgeon practicing in Nigeria,
Yes.
what are the challenges therein that we need as a matter of urgency to address?
Let's look at the common neurology and neurosurgical problems in our environments. Topmost is trauma to the head injury, and then spine injury. These are things that happen to a normally healthy person who develops, maybe has an accident or something, fall or something. It happens like, if you go to the trauma center at National Hospital, it's like a basket load of those cases every day. Then stroke. Yes, stroke is a major non-communicable disease here in our environment. Stroke can be bleeding into the head, hemorrhagic stroke, or ischemic stroke, when blood supply to the brain is interrupted. And then we have infections, also CNS infections like meningitis, brain abscess, and so on and so on. Of course, brain tumors. Brain tumors are on the increase. They were there, they've always been there, but because we have a ability to diagnose them now, we see lots of them, and so on and so forth. So these problems are there. We're able to diagnose them because we have the diagnostic machines, biomedical engineering, CT scan, MRI, we see them. Now let me talk about sudden death, right? So there's nothing like sudden death. Death is a process. It's simply because people neglect those early signs. For instance, you're having palpitations, a little chest pain. Oh, it's nothing. Take paracetamol and walk away. Those are warning signs. You're having some headache. You take paracetamol. Let me tell you, that headache is not just ordinary headache. That headache is a warning sign. It's telling you that your blood pressure is very high. You should go get yourself checked out and reduce the blood pressure. Because the heart and the brain, they work together. The heart pumps blood to the brain. So if heart stops because it is overburdened by your high blood pressure, that's cardiac arrest. Brain cannot survive for more than 3 minutes, without a blood supply to it. So those things will cause a sudden death. Now, let me focus on stroke, which is what I do every day. I run an ICU where we have sometimes up to 17 stroke patients on admission. And one thing common to all of them is that they come unconscious. Time to intervention is key. Some of them present early, some of them present much later. But the earlier the presentation, the better the outcome. Therefore, when stroke happens, please do move early to seek help at the appropriate place. No time for wasting.
When we are talking of appropriate place, where do you go? Primary health care? Is that any succor for you there? Or the next level, the general hospital?
Now, let me sound a note of warning. Any hospital that has no facility to conduct a quick brain scan, CT scan, on a patient who presents with features of stroke, sudden onset headache, collapse, you have no business keeping that patient. You should refer that patient to a center where that patient can get help. Now, a center that is equipped to manage stroke should have not just CT scan, must have a neurology, neurosurgeons who are equipped to make that diagnosis, interpret the results, radiologists to interpret the results. In addition, we must have an operating environment, an enabled operating environment to intervene. Operations for stroke oftentimes will involve opening the head. If you don't have those facilities, you don't have any business keeping that patient. And the patient is unconscious, is struggling to breathe. An unconscious patient cannot sustain his airway. Therefore, you must have facilities to provide mechanical support for the ventilation, mechanical ventilation. What I've just described happens in the concept of an intensive care unit. Managing an unconscious patient requires that that patient must be in an ICU setting, appropriately staffed and equipped to provide support.
And so that's where leadership and clinical governance infrastructure comes into it. So we've been able, they're intertwined. We've been able to travel that journey, and this, unfortunately, our time is up. And but what I can promise you, my viewers, is that we'll bring Dr. Charles back again on bridges. So today we have been able to, do we have a bridge? Final word. Do we have a bridge to leadership and clinical governance infrastructure? Have we been able to do anything?
Yes, we have done substantially well in building that bridge. We're not done yet.
Yeah, we're not done yet. Yes. So we need to sustain the bridge and make the bridge relevant and good for purpose going on. Well, thank you so much, Doctor, for your time. I know you're on high demand, but you still chose to help us build a solid and sustainable bridge on leadership and clinical governance infrastructure, and of course touching on also biomedicals. We'll continue to speak to this because health, they say, is wealth, and this is what we can promise you in the year 2025, that as we look at other sectors of human development, would always bring in health. So see you same time next week. Thanks for watching.